loved ones would normally gather together in large groups to celebrate the Passover Seder. The spirit of Passover, the theme, is about life in the midst of death and hope in the midst of despair, and those themes could not be more poignant than at this moment in our history. Today and tonight actually are different from other nights in this crisis so far. They are both better and worse. The 24-hour death toll from the virus in the U.S. has surpassed 1,850 yesterday. That was the record for any country on a single day. And the number of cases in New York State alone is now greater than that in any other entire country, having surpassed Italy. But in the midst of those dark and discouraging pieces of information, we are also getting new glimmers of hope. Governor Cuomo described today that the number of hospitalizations in New York have been decreasing, not the overall number, but the rate of hospitalization. He said that it seems that we are indeed flattening the curve. And so it is appearing that New York may be nearing or perhaps have reached the apex of this crisis, and that New York may soon emerge, and that other states may see how it is possible to come out through the other side. In fact, other states are seeing that. Washington State, which had been hardest hit to begin with, seems to be recovering, and California is feeling confident enough in its state that it is actually giving some of its ventilators to other states. So that is the moment that we are in. We are expecting the President of the United States to come out any moment. My team and I have been doing these fact checks for a while now because President Trump often uses these briefings to share information that is not factually accurate. And while we want you to witness these briefings because they're important, they shape what is happening in our country, we don't want to allow false information to be shared uncritically. So we are doing our best to fact check in real time. While we are waiting for the president to come out, we would like to take your questions. So please start typing them in the comments, and the team and I will do our best to answer them for you. I want to bring you up to speed a little bit on what happened yesterday in yesterday's briefing. I start to say yesterday was a strange briefing, but they're actually all fairly strange. Yesterday, the president contradicted himself 3 times in 3 very striking ways. He attacked the governor of Wisconsin and Democrats in Wisconsin for seeking to delay Wisconsin's vote that was scheduled for yesterday. He claimed that they were only wanted to delay the vote to stop a candidate for a judicial post that he had endorsed from being elected. That was a false claim. In fact, Governor Evers had been pushing for Wisconsin to delay the vote for public health reasons before Trump endorsed a candidate. But moments after attacking Democrats in Wisconsin for wishing to postpone the vote, he also attacked Democrats in Wisconsin for not postponing the vote. When he was asked about the situation, that people were waiting in long lines and showing up at crowded polling places, he said that it was Democrat Tony Evers' fault, that you should blame him for not canceling the election. Again, it was Republicans. It was Republicans who sued to block the Democratic governor from postponing the election and forced Wisconsinites out into the world in the midst of a pandemic to stand in crowded lines and choose between protecting their health and protecting their votes. President Trump also complained about the idea of people voting by mail and suggested that the only reason people would want to vote by mail is because they want to cheat. He then acknowledged that he votes by mail. I don't know if that was an acknowledgement that he cheats. I don't think it was intended as such. I think it was just another blatant contradiction. And he started yesterday's briefing by announcing that he was cutting off U.S. funding of the World Health Organization. And then, when he was asked during the briefing, isn't it a little risky to cut off funding for the World Health Organization in the midst of a global pandemic? He said, I didn't say that. He did. You can rewind to the beginning of the press conference. He said exactly that. The head of the World Health Organization responded today, urging against politicizing this pandemic, and warned that doing so would lead to, quote, many more body bags. So that was yesterday's press conference. Now then today, President Trump started the day. Again, he started the day knowing that the U.S. had just suffered its greatest single day loss of life from this pandemic, the greatest single day that any country has endured. And he started his day by attacking his opponents. He started his day by tweeting about radical left Democrats and bragging about the ratings of his press conferences. Now, it is very striking. You're going to see this. I expect that you are going to see this today when the president comes out. I expect you are going to see that he's going to read a written statement, and while reading the written statement, he's going to say the things that a president should say. He is going to say that we should all come together, and he's going to praise the governors who have been fighting to protect people in their states. He's going to praise, most of all, the doctors and nurses who have been risking their lives to keep people healthy. That's what he's going to say when he speaks from his scripted remarks. When he's speaking off the cuff, it tends to be more in line with the tweets I just highlighted, attacking, quote, radical left Democrats, bragging about his ratings, suggesting that doctors and nurses are thieves who are stealing medical equipment, and that's why there are shortages. So that's what I think we can look forward to. Again, we are awaiting the president. Now, I just got an alert from a member of the White House press corps. I just got an alert that a member of the White House press corps is being tested for the coronavirus. This individual started to feel ill earlier today and will receive a rapid test tomorrow. Results are expected by the end of the day tomorrow. And this is a striking piece of information. You'll notice, I'm going to go full screen on this briefing room. So you'll notice that the briefing room is not large, and you'll notice that not everyone is actually 6 feet away from other people. So a member of the press corps who was in the briefing room yesterday started to become ill. That means that member of the press corps was in that room with, simultaneously, both the President of the United States and the Vice President of the United States and the two top medical experts on the coronavirus task force, highlighting again why it is so odd that this administration is not taking greater precautions in its own behavior, and highlighting that maybe the top people in this administration should not be in the same room with each other every day. Now, we are awaiting the president. He should be out any moment. And in the meantime, please type your questions in the comments, and our team members will try to find answers for them. I'm going to answer a couple questions we didn't have a chance to get to yesterday. Mark asks, how many ventilators in total have shipped from the federal stockpile to the states? The answer is that the government had close to 10,000 ventilators as of last week, and that includes both 9,000 in the emergency stockpile and about 900 from the Department of Defense. In Louisiana, where coronavirus cases are skyrocketing, Governor John Bel Edwards has requested 14,000 ventilators from the federal government and from private companies. To date, the state has received just a few hundred from the federal government. The federal government has employed, I'm seeing contradictory numbers. I believe the federal government has deployed 4,400 to the city of New York. Oh, I'm sorry. Yes, this is correct. 2,400 to the city of New York, an additional 2,000 to the rest of the state. Okay, here we have the task force members coming out. So the President of the United States should be out shortly. It's also worth noting that the Secretary of State is present at this briefing. So not only do we anticipate the President of the United States and the Vice President of the United States standing in close proximity to each other, but we expect that they will also be standing in close proximity to the Secretary of State, which is perhaps a dangerous prospect. I'd like to note that in the immediate hours following the 9/11 attacks, President Bush and Vice President Cheney explicitly worked to make sure that neither of them were in the same physical location at the same time. Anyway, so I was answering the question about the number of ventilators deployed. So I told you that there have been 2,400 to the city of New York and 2,000 to the rest of the state of New York. This is markedly less than the state of New York has asked for. The state of New York has asked for between 30,000 and 40,000. And now here is the President of the United States. So I'm going to switch over to him, and we'll be fact-checking in real time. And I am aware that we are not receiving his audio. We are, again, working from home. I am now working to get you the President's audio.
Thank you. This is a holy week when religious believers across the nation will observe Passover, Good Friday, and Easter. Millions of Jewish families begin Passover at sundown tonight, a sacred, unbroken tradition that traces back to the ancient land of Egypt. And on Sunday, we celebrate our beautiful, wonderful Easter, which we all look forward to. And we're going to have many Easters together in churches in the future. We're getting closer. You see the numbers. We're getting much closer to getting our country back to the way it was. We have now an extra 2 countries that have been attacked, 184. They're being attacked as we speak, but we'll all win. At some point, we're going to all win. We're going to do it sooner than people think. Earlier today, I spoke with 10,000.
Now, the President keeps phrasing this in of a war, which is not a perfect analogy, and he says that we are going to win. It is important to note that under his estimations, we're expecting to lose between 2 to 4 times the number of Americans who were killed in Vietnam. So it is difficult to call this a win.
Our administration's ongoing drive to beat the virus, to crush the virus, and that's happening. It's happening, I think, if you look a little bit more quickly than people thought, maybe a lot more quickly, I hope. And it's something.
The President is saying that we're going to beat this more quickly than anyone had thought. He had said in February that this would go away on its own in April. We are now in the midst of April, and it is far from gone away.
Spoke with the representatives of the UK, and I think that their great Prime Minister is doing much better today, or at least better. But certainly he's had a tough bout, and he's still going through a tough time, but he seems to be doing better, and that's good. And we send our regards to Boris and his family and his friends, all of the people that really love him. He's become a very popular, before this happened, became a very popular Prime Minister. He's doing an excellent job. He loves their country. He loves our country. So we appreciate everything he's done, and hopefully he's going to be okay. Speaking of great people and people that have done a fantastic job, I have Secretary of State Mike Pompeo with us, and I'd like to ask Mike to say a few words, and then I think what we'll do in order to get him back.
Now, the President has just called Boris Johnson, the British Prime Minister, a great person. We all wish for the Prime Minister's speedy recovery, but while calling him great, it's important to recognize his history of deeply troubling homophobic, Islamophobic, and misogynistic statements.
Importantly, to get them home. As you know, when many countries shut down their rail lines, their buses, their infrastructure systems, the capacity to get out of those countries, they were trapped, they were stranded. The State Department swung into action. Since January 29th, we have now repatriated over 50,000 United States citizens back to their homes. From more than 90 countries, more than 490 flights back to the United States from all across the world. This worldwide scale of our repatriation efforts is without parallel in our lifetime. We are coordinating with foreign governments, militaries, airport authorities, medical units, transportation companies, hotels, you name it. We're working with them to make sure the American people get back to be with their families. You can see behind me the map of the flights that we have brought back people from all across the world. Every day I get a chance to hear some of the remarkable.
I do want to highlight that some of the early efforts to bring Americans back from other countries involved bringing Americans back specifically from Wuhan, China, after the situation in Wuhan was so severe that the city was locked down entirely. The State Department brought back 6,000 Americans at the end of January, and that was, of course, before there were any statewide guidelines that would help to prevent the spread of this disease from people in the U.S. who might be returning from China.
Get back home to my dad. Pretty neat. We've received similar messages from lots of people. They're proud to know that their country will not leave them stranded, and we're going to get them back home. One woman wrote, quote, "I was in tears when I received the email approving our flight back to the United States. God bless the United States of America." And another said, "I felt like I had allies there that actually treated me like a person or a family member, not just a number." The Repatriation Task Force, State Department, our consular officers have done great work. I want to thank our partners in the Department of Defense who have helped with some of these flights back home, and other government agencies, our sisters and brothers across the United States government and this administration that have helped get these people back. And then lastly, aside from our repatriation efforts, we continue to help countries around the world as well. We've got CDC officials helping these countries with expertise and all the things that these countries need to get their citizens safe and healthy and back so that we can get the economy all across the world, the global economy, back on its feet when this crisis is over. Thank you, Mr. President.
Good, thanks. Right, maybe you stick for a little while.
Sure.
We'll see if anybody has any questions for Secretary of State. Anybody, please?
Sure. Mr. Secretary, that's an amazing effort that you have made. How do you know when you're done? Because I imagine there are Americans on all corners of the world, and you're always someone's going to pop up and say, "I want to go home now."
It's
when
a great,
do you give the old
yeah.
call that
So
it's
a great question. We still have several thousand people that we're working. They identify themselves every day. New people find themselves in a difficult place. Look, we're going to be done when people can travel on their own again. These people traveled abroad on vacations or with their church, and we're intending to get back on their own. We hope that day comes pretty soon where they don't have to rely on the State Department to get them back home. But know this, in the meantime, We're devoting all the resources we have to get them. They're often in difficult places. They're not in the capital near the airport, or the roads are closed. And so it's not just a matter of getting a flight down there. There's a lot of work that has to be done to coordinate, to make it all happen and get those people available so they're sitting there when the flight lands, they can get on the plane, and then we can get them back home. We still have several thousand. We're working on it. We chip away at that number every day. But new citizens go to the State Department website, identify themselves, and say, I need a little bit of help in some way, and we do our best to get that to them just as quickly as we can.
You'll keep it up indefinitely.
We're going to keep it up as long as we have resources to do it, and there is a need. Yes, sir.
Mr. Secretary, how many of these staffers have tested positive for coronavirus? Have they been tested, or are they going into quarantine? And what does this do to diplomatic efforts overseas? If you're pulling 50,000 people out of national capitals, nation capitals all over the world.
So the vast majority of these 50,000 weren't our officers. These were ordinary citizens who were there traveling for business or for commercial or for their trip of a lifetime. We've seen some of that in the cruise ships, but of course they're stranded all over the world. So our embassies, save for the one that is in Wuhan, which we did pull everybody out of, the rest of our facilities around the world are all open. We've had a handful of our folks now test positive. But we feel like we have a good handle on it, and we're doing everything we can to make sure that not just the State Department officials, but our Department of Defense colleagues that are working on these missions as well are doing so in a way that reduces risk to them and their well-being also. Yes, ma'am.
Thank you so much. Do you feel like China withheld critical information from the United States, and will there be any consequences for that?
You know, this is not the time for retribution, but it is still the time for clarity and transparency. We're still working on this problem set. There's still data that these good people need so that they can perform.
Now, the Secretary of State says this is not the time for retribution. This has been a shifting position for this administration. There was a period of time during which the president insisted upon calling this the, quote, Chinese virus. And there's also yesterday, he was attacking the World Health Organization, suggesting that it was too pro-China. But then he flips because the president has also praised China's response. So it is hard to know what to expect from the administration on the subject of China.
This sooner with the United States?
Every country has an obligation to share that information accurately, timely, completely, transparently, and thoroughly, just as quickly as they can gather it. We'll leave for another time to evaluate how everyone did in that.
Go ahead.
Thank you, President Trump. And Secretary, I have a question. The World Health Organization has a fundraising drive for about $700 million for coronavirus resources. China has only donated $20 million. The United States actually has donated less. So do you feel that China should be giving more to this World Health Organization effort? And could you comment on the U.S. donation?
You want to say something, Mr. President?
Well, you could just say we held.
At this point, we're reevaluating our funding with respect to the World Health Organization. Now, this is very consistent with what President Trump said since the beginning of his campaign. Organizations have to work. They have to deliver the outcomes for which they were intended. And we need to make sure that not only the World Health Organization, but every international organization, that we take taxpayer money and give it to them for the benefit of America. We need to make sure it's delivering on those taxpayer dollars. The World Health Organization is no different in that respect. They have to execute on the mission that they are designed to achieve. And we've seen, with respect to the World Health Organization, here we are. It hasn't accomplished what it was intended to deliver.
Well, this slam at the World Health Organization is very misplaced. The World Health Organization warned of this crisis, announced that it was a global health crisis in January. President Trump did not acknowledge it as an emergency until the middle of March. The World Health Organization produced over 250,000 tests, which it distributed to countries around the world, offered to the United States. The United States said no, and as a result, widespread testing did not begin in the United States until March. So to pass the blame off to the World Health Organization is blatantly misleading.
They chose not to take that. I've heard people talking about sanctions. The world should know there are no sanctions that prevent humanitarian assistance, medical supplies, pharmaceuticals from going to Iran. We offered American assistance. We've tried to help other countries get assistance in there as well. had some ability to do that.
The Secretary of State is claiming that the sanctions that President Trump has placed upon Iran when he tore up the Iran deal are not contributing to the problems with coronavirus in the country. Human Rights Watch called BS on that and said that the sanctions are causing immediate medical supply shortages and also preventing other countries from contributing aid out of fear that they might run afoul of the U.S. To date, there have been 64,000 cases in Iran and nearly 4,000 deaths.
Healthcare, global epidemic, healthcare infrastructure. It's good people like that you see sitting to my right that have been working on this all their life, all around the world, putting these countries in a place where they're better prepared for a virus like this one.
Have any U.S. diplomats or U.S. officials contracted the virus as they've tried to rescue U.S. citizens abroad?
Not that I'm aware of. Not that I'm aware of, but there's no doubt. I remember when we sent our team to get our officials and about 800 American citizens, non-government citizens that were living in Wuhan. I remember when we sent one of our first repatriation flights in there, we were very careful. We sent trained professionals in, but they were going into a very, very difficult, very fraught place. We were blessed. They all got back with no one having contracted the virus on that trip. I'm not aware of any of our officials that have had the virus attack them while they were performing their functions, trying to get people back. And we have a number of State Department officials who have COVID-19 now and are working their way through. In fact, we've had 3 fatalities of local employees, not U.S. direct hires, but local people who were working for the State Department and embassies around the world. We've had 3 fatalities so far.
So there have been some calls on the World Health Organization for a leadership change there. I was wondering what your thoughts are on that. Senator Martha McSally, for example, has called for Dr. Tedros to resign.
I don't want to look. This is not the time to be doing that kind of change. There'll be a lot of time to look back and see how the World Health Organization performed. In the meantime, what our task is to preserve and protect the American taxpayers, to make sure that our resources don't go to places that aren't going to deliver on behalf of the American people in the world. And President Trump and I are determined to do that.
Okay? Follow-up, let's save it. Can we save it?
Just a quick follow-up, sir, on
He's
China.
a busy man.
You said that China has a responsibility to get correct figures. How would you broadly characterize cooperation with China right now?
There's lots of places we've been cooperating, right? They're providing us assistance where we need it. There are places on the ground now where we do have access to the data we need, and we're deeply appreciative of that. They've said they want to cooperate. We're completely prepared to cooperate with them. That cooperation means sharing data, being transparent, being upfront, allowing information to flow freely. That's our expectation, not just of China, though, of every country that is in this place today. Collectively, we have to work our way through this, and to do that, you have to have really good data.
Okay?
Of course, the U.S. data has been severely the fact that it has taken so long to have tests, and most Americans still cannot get tests if they want them.
It's around the country, as you know, including 6.6 million to New York and New Jersey, 1.8 million to Chicago, 1.7 million to Detroit, and 837,000 to New Orleans. I spoke with the governor of Louisiana a little while ago, and they're doing really pretty well, much better than they thought. They'll be using fewer beds. As you know, we built a hospital. We're about set to complete another hospital, and there's even a possibility they won't need it. That's what we discussed. To date, we've shipped out more than 8,000 ventilators, and we have almost 10,000 sitting there ready to go should we need them, and an additional 2,200 newly manufactured ventilators come online on Monday. We're going to be sending them to various locations just in case they need them.
It is important to note that the leaders of multiple states, the governors and health professionals have warned that the amount of ventilators they are getting does not meet their needs. Furthermore, the New York Times reported that thousands of ventilators that the government has sent out turned out to be broken, including 150 ventilators that were sent to Los Angeles.
We're going to have a big stockpile when we're finished, and we expect to be sending quite a few to other countries to help them after we're finished. And even now, a couple of countries are really, really in dire need. And it looks like our projections were right on ventilators. And some states that were thinking they would need thousands of more than they thought are now already taken care of, which we're very happy about.
The president is claiming that all states are taken care of. Again, states are saying they do not have the ventilators that they need. New York has 4,600 people currently on ventilators, and the governor says that New York is in good shape for this next week, but that after that, New York may run out of ventilators.
Or for the stockpile. So we'll be in a position to have something incredible. So that'll be a total of 500 million masks. And today, 750,000 new protective gowns landed in Dallas, Texas, as a result of a partnership led by the federal government, DuPont and FedEx. And that's been a great partnership. That's worked very well. So we have 750,000 new protective gowns, and these are at a high level, very high quality. As American industry steps up to help, so are America's doctors and scientists. 10 drugs are now in clinical trials, and my administration is taking unprecedented actions to make new therapies and treatments available without delay. The doctors, the lab technicians, the companies, I spoke to them yesterday, I spoke again today. They are coming up with things that are, I hope, in the very near future are going to be very, very special. Our national stockpile is now equipped with nearly 30 million hydroxychloroquine pills.
Hydroxychloroquine seems to be the president's latest obsession. It has not been proven to be effective against the coronavirus. There have been only 3 studies, 2 in China and 1 in France, and all 3 have drawn criticism, and none of the 3 found conclusive evidence that the treatment would reduce deaths or intubations or cardiac arrest. However, the president keeps pushing it. The New York Times and one other organization have uncovered that the president has financial ties to at least 2 companies that produce hydroxychloroquine.
The azithromycin and zinc, they say zinc. You should add zinc. Now, it's all...
Azithromycin is an antibiotic. Antibiotics kill bacteria, not viruses. So azithromycin cannot cure the coronavirus.
Azithromycin. And it's been, we've had a lot of good stories, and we have almost 30 million doses. So we've got a lot. I want to thank Prime Minister Modi of India for allowing...
So there are a couple things very disturbing about the fact that the president has asked the government to purchase 30 million doses of hydroxychloroquine. For starters, there are actual conditions that this medicine is used for, including rheumatoid arthritis, lupus, and malaria, and there has actually been a shortage reported of the drug because of these efforts. Furthermore, I want to quote Dr. Michael Ackerman, a cardiologist at the Mayo Clinic. He said that it is, quote, inexcusable for politicians and the media to describe hydroxychloroquine as safe without mentioning its rare but very serious side effects. Ackerman told NBC News that the drug could pose serious and potentially lethal cardiac arrest risks to up to 10% of the population, including people susceptible to heart conditions, and especially those with other chronic medical problems already on multiple medications.
Hundreds of millions of dollars has been paid to the World Health Organization, hundreds of millions of dollars a year. And last year was $452 million, and China paid $42 million. Before that, it was $500 million, and China paid less than $40 million. And before that, it was similar numbers in the 400s, 300s, and sometimes even in the 500s of millions of dollars. And China would do proportionally just a small fraction of that number. And I think they have to get their priorities right. And their priorities are that everybody has to be treated properly, every country. And it doesn't seem that way, does it? It doesn't seem that way. So we're going...
The president seems to be suggesting that the World Health Organization has somehow mistreated the U.S. The World Health Organization made tests available to dozens of countries, including the U.S. The U.S. rejected them. President Trump, who has frequently used the phrase America first, says that he does not want America to be first when it comes to paying for things like the World Health Organization, although Republicans had criticized Obama and used the phrase leading from behind. It appears that President Trump does want to move us behind other countries when it comes to issues like funding the World Health Organization or NATO.
And not good. I want to take this opportunity to express the thanks of an extremely grateful nation to the Americans who go to work every day, especially in these critical industries in the midst of the pandemic, to care for and protect and feed American people, including medical personnel, law enforcement, first responders, food suppliers, sanitation workers. And somebody mentioned today, would you please specifically call out cashiers and clerks at grocery stores who are in danger during the pandemic?
So the president is specifically and rightly praising cashiers and clerks and sanitation workers. It is important to note that Republicans in general and President Trump in particular have been refusing to increase the minimum wage and have been saying that these workers are not worth $15 an hour. In fact, President Trump has suggested that they are not worth $7.25 an hour because he actually has said that the minimum wage is too high as it is. Also, President Trump in this address has been pushing zinc. Doctors warn against taking too many supplements and specifically against taking too much zinc. Zinc nasal spray, for example, can cause a permanent lack of smell if used incorrectly. Although I can tell you that here in New York, that could sometimes be a blessing.
In the right direction. I feel strongly about that. Some terrible days ahead, but we're going to have some wonderful days ahead. And we're going to get this behind us, this terrible thing behind us. Some people will never be able to forget if they had a loved one, if they had a great friend or a friend. But we're going to get it behind us. This is a tribute to the discipline and the devotion of the American people, what we've accomplished. If every American continues to strictly adhere to social distancing guidelines, we can defeat the invisible enemy and save countless lives, so we can do it much more quickly.
The president says that it is important for every American to follow these social distancing guidelines. It's not so easy for every American because the president has refused to issue a nationwide shelter-in-place or stay-at-home order, and as a result, 8 states, and these are all states with Republican governors, have refused to put such a condition in place.
Congress to provide an additional $250 billion to expand the incredibly successful Paycheck Protection Program. You've seen what's gone on there. It's incredible, actually.
The Paycheck Protection Program cannot be described as being wholly successful. Banks are finding that they are overwhelmed with applications and are unable to process them. And on the day of the rollout, the website involved crashed. You may remember that President Trump was staunchly critical of President Obama for the collapse of a specific website.
Agendas, we want to do this for the small businesses and the workers. And we can do a phase 4, and a phase 4 will be later. This will be an expansion of what we've already done because it's so successful. The $350 billion will be expanded by hopefully $250. And if you look at the kind of loans, thousands, tens of thousands of loans to small businesses, it's a great thing to see. It's turned out to be more successful and more productive than anybody would have thought. But Democrats and Republicans are coming together to get that job done. That's a very important job. In recent days and days ahead, we'll restore America's health and economic might, but also dimensions of our national strength will be brought together, I think we have a chance to be stronger than ever before. We've learned a lot. And we have tremendous stimulus now, and we're going for more. Hopefully we'll be doing an infrastructure bill so we can rebuild our roads and highways and bridges and tunnels and all of the things that we should.
The president is saying that there is tremendous stimulus. It's important to note that all that has been provided on top of unemployment at this point is a single lump sum payment of $1,200 to most Americans. This is distributed evenly across the country, regardless of cost of living in certain areas. So it makes quite a bit of difference where you live. If you are at the heart of the coronavirus pandemic, $1,200 will not get you very easily a one-bedroom apartment in Mitch McConnell's Kentucky. $1,200 can be a month's rent on a three-bedroom house.
So we're getting very close, and hopefully it will. Hopefully it's on the other side, and it will end soon. And I think it will. And I just think that the people of this country are fantastic. So we'll take a few questions, and then Vice President will take over. Please, go ahead, please.
Thank you so much, Mr. President. ABC is reporting that your intelligence community was warning about the virus as early as November and produced a detailed report about the outbreak in China. When did you first learn about the intelligence, and could you have acted on it then?
Well, I learned when I learned about the gravity of it was sometime just prior to closing the country to China. And when we closed up the flights coming in from China and various other elements, and then, as you know, we closed up to Europe. So I don't know exactly, but I'd like to see the information. Yeah.
What the president is saying is false. He was just confronted with new reporting that suggests that intelligence officials were warning of this crisis as early as November of last year, which is earlier than we previously knew. The president is claiming that he only heard of it right about the time that he placed restrictions on China. That is not true. We know that the National Security Council within the White House was briefed by at least January 3rd, and it was not until February that travel restrictions on China went into place. Also, they were not a full ban. There's a lot that he gets wrong about the China policy.
All of a sudden, things don't happen. But I think we will be sooner rather than later. But we'll be sitting down with the professionals. We'll be sitting down with many different people and making a determination. And those meetings will start taking place fairly soon.
So you wouldn't do that until the health experts tell you it's safe to do it?
Yeah, I would rely very heavily on them, yeah.
Do you think, is there a system for monitoring and testing that you're looking at?
Yeah, we're putting in very heavy testing systems. We have the best testing systems. And again, don't forget, when we look at cases, I'm looking at I'm not going to insult anybody, I'm not going to insult any country, but I'm looking at countries that are showing less cases than us. That's testing.
Okay, countries that are showing less cases than us is all countries. The U.S. is number one in the world for coronavirus cases. President Trump has delivered on his America First agenda in that regard. Also, in terms of suggesting that we are doing better in testing, that is simply not true. Most countries are testing more people per capita, and a new Washington Post piece today says that there is still not a national testing strategy in place, something that experts say is key to blunting the outbreak and resuming everyday life. I'll tell you more about that in a moment.
Head of the Tennessee Valley Authority, and he made $8 million last year. And
It's ridiculous. I agree. It's ridiculous. I think it's the highest paid government. Long before I got here, you said Tennessee Valley Authority, right? Has to be the highest paid man in any government. Makes approximately $8 or $9 million. I don't know the gentleman, but he's got a heck of a job. He gets paid a lot of money. He's been there for a long while, hasn't he?
This one actually is new. It came in April, but the previous
Well,
one
that's
was...
that's separate. But I'm talking about we just have some new people going on the board, I know. But as you know, that's a quasi-public agency. And whoever the head of the agency is, that person makes a lot of money.
If I could ask my Second question.
which is an amazing thing, right? And when we want them to do something, they're not there for us. That's not good. That's not good.
The second
They've been there
question,
for a long time. That's been a story for a long time.
I assume that you would support reducing that salary as part of the infrastructure bill.
Yeah, reducing it by a lot.
Thank you. And, my other question
That'd be
is,
the greatest job in the history of government, almost. Certainly if you're into money. Tennessee Valley Authority, that's right. Go ahead.
so
I've been waiting for somebody to ask me about that. It's been bothering me for a long time, too. Go ahead.
One of the biggest rating hits of the coronavirus, aside from these briefings, has been a show on Netflix called Tiger King.
Yeah.
And the man who's the star of this is a former zoo owner who's serving a 22-year prison sentence. He's asking you for a pardon, saying he was unfairly convicted. Your son yesterday jokingly said that he was going to advocate for it, and I was wondering if you've seen the show and if you have any thoughts on pardoning Joe Exotic.
Which son? It must be Don. I had a feeling it was Don. Is that what he said? I don't know. I know nothing about it. He has 22 years for what? What did he do?
He allegedly hired someone to murder an animal rights activist, but he said that he didn't do that, and he was...
This is really a startling moment of the press briefing on the coronavirus. One day after the U.S. suffered the single highest death toll from the coronavirus in a one-day period of any nation, we're debating Tiger King in the White House briefing room.
Last week, your top experts were saying that we should expect 100,000 to 240,000 deaths in this country. You've been talking about how it looks like maybe things are plateauing. Are these numbers now being revised downward? I know you don't want people to stop social distancing and that sort of thing, but what can you tell us about the numbers? Are they being revised?
My impression, Jim, is those were the numbers that were set, and they were set as an expectation from quite a while ago. I think we're just doing much better than those numbers. If either of you would like to talk about that, it's a fair question. You want to come up, Deborah?
I know Dr. Redcliffe said
Yeah, so I think many of you have done the analysis of the same models that we utilized. And if you do the models of the models, you end up with that range. At the same time, we've carefully looked at Italy and Spain, and we are doing much better in many cases than several other countries. And we're trying to understand that. We believe that our healthcare delivery system in the United States is quite extraordinary. I know many of you are watching the Act Now model and the IHME model and they have consistently decreased the mortality from over almost 90,000 or 86,000 down to 81,000 and now down to 61,000. That is modeled on what America is doing. That's what's happening. And I think what has been so remarkable, I think, to those of us who have been in the science fields for so long is how important behavioral change is, and how amazing Americans are in adapting to and following through on these behavioral changes. And that's what's changing the rate of new cases, and that's what will change the mortality going forward, because now we're into the time period of full mitigation that should be reflected within the coming weeks of decreasing mortality. I mean, that's what we really hope to see. We are impressed by the American people, and I think models are models. I've always worked on validating. I spent my life validating models all over the world, and that's why we do surveys and surveillance, and we make sure that what we think is right is right. I think this will change how people look at respiratory diseases, because it will change what is possible when the globe, and particularly the American people, do this level of mitigation. And I think, as I talked about yesterday, we are still in awe, really, of the American people's strength in this and following through.
If I could just ask President.
Yeah, I'm going to do that. I'm going to ask Bob to come up just for a second. Director, I think that's it. They have done, everybody has done, everybody a great job. So those were original projections, and we don't want to say anything about beating it yet, but I think we will have a very good chance to beat them very substantially. Bob, please.
Now, what the Dr. Birx has just pointed out is that beating the projections are based on following these guidelines, and there are still at least 7 states with Republican governors that are not following any sort of stay-at-home order. Now, I'm going to, this is the CDC Director, Dr. Robert Redfield, speaking, and before I turn it over to him, I just want to highlight that it was Redfield who helped establish the military's policy of mandatory HIV testing in the Reagan era, and this led to forced quarantines and frequently dishonorable discharges for service members. Redfield was allied with a right-wing Christian group that declared that AIDS was God's judgment, and he urged Americans not to use condoms or for governments to implement needle exchange programs. He is one of the Trump administration's lead figures now in addressing this crisis.
People were shocked that I acted so quickly, and everybody thought I was wrong because I did act so quickly, as you know, with respect to closing the borders, with respect not only to China, but with Europe. I closed the borders, and I think that was very important. But no, I didn't see the memo at the time, but I have seen it since. Yeah, please.
One other
Wait
quick
a minute,
question.
Jim, let me do a couple of others. We'll go back.
The head of the World Health Organization today warned against politicizing.
I agree with that.
He said that
Now, what the president just said again about everyone was amazed about how quickly he acted. That is, of course, false. As we are increasingly finding out, there were warnings as early as November of this coming, and the president did not declare a national emergency until March 13th. He's also saying that he was early in placing restrictions on China. That is also not true. Those did not go in place until February, and about 300,000 people entered the country from China in the month of January. And he also was not telling the truth when he says that he received lots of pushback and objection. He did not. The move to place travel restrictions was, by and large, accepted by members of the administration, by Democrats and Republicans alike.
$152 billion, almost $500 billion last year, hundreds of billions in previous years. And they got to do better than that. They got to do better. When you talk about politics, I can't believe he's talking about politics when look at the relationship they have to China. So China spends $42 million, we spend $450 million, and everything seems to be China's way. That's not right. It's not fair to us, and honestly, it's not fair to the world. Okay, question in the back? Yeah.
Thank you, Mr. President. There's breaking news today and a couple of reports from a couple different outlets that Jared Kushner's team is seeking to create a national coronavirus database, a tracking system for patients who've been diagnosed. Now, his spokesperson said that that's not true.
Yeah, it's not. I have never heard about it. Doesn't sound like a bad idea, actually, but I have not heard about that.
Be okay with it if it...
I don't know if I'd be okay. I have to see it, but it sounds very scientific, and it sounds like it could be good based on tracking, but it also has to do with rights and lots of different constitutional questions.
I want to point out that Jared Kushner, the president's son-in-law, has no experience in public health or in crisis management, and he is one of the top people in this administration running this public health crisis management.
In all fairness, no, I don't know anything about it. I haven't heard it. I mean, I'll speak to them. I don't think so. They would have told me. I would have known about it. Please.
Thank you, Mr. President. The Nevada delegation is unhappy because smaller casinos and businesses that make profit from gaming in Nevada found out they're not eligible for the CARES Act PPP money. Is this, and I talked to one member who said gaming...
You mean because of the number of employees?
Because of the number of employees...
And yet they're small business.
And they thought gaming would not be treated any differently than any other business with this. Was this
Well,
an
I could
oversight?
look at that. I could look. It's a great state, and I will take a look at that strongly. Are you talking only the smaller casinos? Yeah, I'll take a look at that. Fine. I don't mind that. Please. Yeah, we'll take a look. Yeah, we haven't heard. Nobody's told me about it, but I'll look at it. It's a great state. They do a great job, so I'm going to look at it very strongly. I understand what they mean. Please.
Thank you, Mr. President. Turning to the economy, what if you urge Americans to go back to work and they don't listen to you? Would you leave that up to the governors, to businesses, to citizens to decide when it's safe to stop social distancing?
Well, when you say they don't listen, I think they're going to listen. They want to go back. Everybody wants. They're going stir crazy. they've been in those houses and those apartments, and they've done a great job. Again, when you look, the question was just asked about, about how are we doing compared to projections. Those were just original projections. The big projection being 2.2 million people would die if we did nothing. That was another decision we made, close it up. That was a big decision that we made. Two very smart people walked into my office and they said, listen, these are your alternatives. And that was a projection of, I guess, 1.5 to 2.2 million people would die if we didn't close it up. It's a lot of people. So if we do a number that's tremendously smaller than that, now if we did close it up, the numbers got to 100.
Now, the president keeps trying to frame the anticipated 100,000 or more deaths of Americans as a win because it is lower than if he did absolutely nothing. It is important to register that. It's also important to compare our performance to that of other countries. South Korea had its first case on the same day as the U.S. and instead of just waiting, implemented a widespread testing and abatement strategy immediately. And we should have, based on population, a death toll less than 10 times that of South Korea, but we are anticipating to have a death toll 1,000 to 2,000 times as great.
Want to sit next to each other like normal at a football game, baseball game, basketball game, hockey game? No, we want to go back to life. Now, the first period of time, maybe we'll go a little bit slower and maybe we'll be talking about distancing, but at some point we expect to be back like it was before. And hopefully it'll never happen. Hopefully it will. If it does happen, it's going to be in 100 years from now. The last one, 1917. That's something. That's a long time ago, and that was a horrible thing. Jim, go ahead.
Yeah, I wanted to get back to something you were saying yesterday about people going to Wisconsin and voting in the middle of this pandemic, really putting their lives on the line. And you said, well, if they do that, vote by mail, perhaps we'll have voter fraud in this country. I just wanted to ask you, voters in 5 states, Utah, Colorado, Hawaii, Washington, and Oregon, all vote by mail. Can you or the White House staff or your campaign provide any evidence to back up your claim that mail-in voting is rife with fraud, like the example you gave of people working in rooms filling out false ballots? You've been talking about voter fraud since the beginning of this administration.
Very fair.
And where's the evidence of it?
I think there's a lot of evidence, but we'll provide you with some, okay?
There is no evidence of widespread voter fraud caused by anything, actually. Widespread voter fraud is not a problem in the U.S. that anyone can find. The president put together a voter fraud task force and had to disband it because they couldn't find any. But specifically, vote by mail has not shown particular instances. Oregon was the leader in this area and has mailed out over 100 million ballots since they began voting by mail 20 years ago. The New York Times says that there have been only about a dozen proven cases of voter fraud in Oregon.
You mentioned is a state that happens to be won by the Democrats. And if you have a position like me where it's registered, you're here and we're voting someplace where I'm not. I haven't left the White House in, I guess, months, other than to, ask a ship to, wave it goodbye to New York, which, by the way, is now going, as you know, being used for the purpose that we're talking about, which a lot of people wanted. Wait a minute.
Voting doesn't work out well for the Republicans.
Well,
so
it hasn't.
Isn't your concern
It
really
certainly
just
hasn't.
political?
But if you're a senior citizen and if you're somebody that needs it, I'm all for it. But they have to be very careful because the things with bundling and all of the things that are happening with votes by mail, where thousands of votes are gathered, and I'm not going to say which party does it, but thousands of votes are gathered and they come in and they're dumped in a location, and then all of a sudden you lose elections that you think you're going to win.
There is no evidence of widespread voter fraud. The few instances of actually discovered voter fraud in recent years have been committed by Republicans, including in a House race in North Carolina.
Something in, you should be sure, as a state and as a country, you should be sure that that vote is meaningful. And it's not just made fraudulently, because there's a lot of fraudulent voting going on in this country. This country should have voter ID. Okay, let's do another one. Go, please.
So the president keeps falsely claiming that there is a problem with voter fraud. There is no evidence of that. He keeps suggesting that voter ID is the solution. The ACLU explains that voter ID is inherently discriminatory. The law deprives many Americans who do not possess proper forms of identification the right to vote. More than 21 million Americans do not have government-issued photo identification and struggle to obtain it. They tend to be disproportionately low income and people of color, also the elderly and people with disabilities.
Down what we have in our stockpile. And again, it's had, I hope it works. Again, I'm not a doctor, as you possibly have found out. I'm not a doctor, but I'm a person with common sense. And we've had some very good results over the course.
The president is, whether he's a person with common sense is debatable, but he is absolutely not demonstrating common sense in recommending that people take hydroxychloroquine without the guidance of a doctor or medical professional.
Become a big fan of it as a medication, as something that's going to help with this horrible virus. And we're delivering it to the governments of various states when they ask. So certain states are asking, certain governments are asking, and we're delivering it directly to the government. Yeah, please, go ahead.
Thank you very much, Mr. President. We know many people around the world are paying close attention to this press conference. So on behalf of
Good. Where are you from?
Media,
Where are you from?
I'm from Taiwan.
Good.
Yes. On behalf of Foreign Media Group, I'd like to ask you two questions. First question is that the French President Macron called Iranian President Rouhani and say that Europe has started to ship the medical goods to Iran. Will you consider
medical goods?
Yes.
That doesn't bother me.
Yeah. So will you think
if they're sending medical goods to Iran, it doesn't bother me. No.
Okay.
Okay.
Yeah. So the other question is that the world also paying attention to the U.S. election. So we are also we know that Bernie Sanders has dropped out today.
I did see that today.
Yeah.
Well, he didn't really drop out. He didn't really. What about his delegates? I mean, he said he's going to keep his delegates, and which is sort of interesting. He's going to keep his delegates, and he'd like to get more. Now, is he dropping out or not? That's not dropping out. When you keep your delegates, and then you want more delegates before you get to.
Bernie Sanders did, in fact, end his campaign today, and the president is misdescribing what Bernie Sanders is doing. He is going to use his delegates to try to influence the platform of the Democratic Party in hopes of making it embrace more of the agenda that he was running on. But he has ended his campaign. He is no longer running for president.
Sleepy Joe, it just hasn't happened. When's it going to happen? When is it going to happen? Why isn't it? He knows something that you don't know. That I think I know, but you don't know. So it'll be interesting. But with Bernie, I saw his standard fare today. I watched. And I hope that a lot of Bernie Sanders people, just like they did last time, we got a tremendous percentage of Bernie people. And I think they voted for me largely because of trade, because Bernie and I agree on trade. We agree that the United States has been ripped off by virtually every country they do business with. The difference is I've done a lot about it, and I'm doing more about it. And we've made incredible trade deals, including USMCA, the deal with China, and then all of a sudden that gets disturbed by this virus situation. But China has to spend almost $250 billion on purchasing our products, $40 to $50 billion with our farmers. And the Bernie Sanders people are big believers on what I'm saying on trade, and I got a lot of them in the last election that surprised people, but it didn't surprise me. No, those are great people. They're great people. But I just...
So the president is claiming he got a huge percentage of Bernie Sanders voters. He did win roughly 12% of Bernie Sanders voters, according to a study, but not by most measures a huge percent.
Yeah, Jeff, go ahead.
Yeah, Mr. President, OPEC is meeting with Russia tomorrow and some other countries to discuss oil prices.
Yeah.
Oil prices are at $23 a barrel.
Oh, that's good. Finally, somebody knows something when they ask a question.
What is your message to them ahead of their meeting tomorrow? Will the U.S. consider a coordinated cut of production here?
I don't think, look, we already cut. You know, we're like very market oriented. If you look at Texas and if you look at North Dakota and if you look at some of our states that do this very well, they've already cut way back. You know, they cut back automatically. But in the case of Russia, in the case of Saudi Arabia, they increased production at a time when you didn't need it, and then they got hit by the virus, which knocked out 40% of the market, and now they're flooded with oil. Look, I just say this. You have two countries that are getting hurt very badly. Russia's getting hurt. That's their primary source. And Saudi Arabia, that's definitely their primary source. And it doesn't make sense that they flooded the market for whatever reason they did that for themselves. It's an argument that they had. And I think they'll straighten it out. A lot of progress has been made over the last week. And it'll be interesting to see what comes out of OPEC tomorrow. But OPEC, obviously, for many years I used to think OPEC was very unfair. I hated OPEC. You want to know the truth? I hated it because it was a fix. But somewhere along the line, that broke down, and it went the opposite way. And we have a tremendously powerful energy industry in this country now, number one in the world. And I don't want those jobs being lost. Okay?
What will you do, just one follow-up to that, sir, what will you do if they don't end up cutting
We'll
tomorrow?
see. I mean, I have a lot of options. Please. Got a lot of good options, Jeff. Beauties. I might like it even more. Now you'll watch. Let's see what happens. Hopefully they can make a deal. Let's go.
Thank you, Mr. President. Clearly, Americans are getting very anxious to go back to work.
I
You're
agree.
sounding optimistic.
Including me.
Still very vague. Now that the IMHE model specifically has been adjusted down to 61,000, when are we going to open back up? Can you give us a better date? Is it going to be April 30th, May 1st?
You said adjusted back down 61,000. What was adjusted back down?
The IMHE model, the one that originally predicted like between 100 and
Yeah, go
200,000.
ahead. Well, it's still a big number, right? 61, right? That's a big number. Go ahead.
But can you give us a more specific date? Will it be
Well, I don't
April
want to do that.
30th,
Look,
May 1st?
I had a date, and I thought it was a very aspirational date. It's turning out to be very interesting because a lot of good things are happening by Easter. But I had a very aspirational date. I didn't think you could make it. I didn't say we would do it by Easter, but I said, boy, wouldn't that be great to shoot for Easter? That would be a great day, beautiful day, very important day to a lot of people like me and like some of you in the room, maybe all of you in the room, frankly. But Easter is a very important day. So I had aspirationally, I said, let's see if we can do it at Easter, you know, but I said it would be very tough. And I was criticized for that. So I don't like giving dates. And that wasn't a date. That was just an aspiration. That would have been incredible. But I don't think we're going to be very far behind. And some of these models are looking like Easter is going to be a very important date anyway because of the curve. I mean, it's hitting the top and it's starting to come down. And one person said Easter is looking like a good time.
Public health officials are not suggesting that the economy could be open or that stay-at-home orders could be rolled back by this coming Sunday. And multiple experts have warned that if these protective measures are rolled back too soon, it will add to the death toll by thousands, and it will lengthen the time that this crisis will endure, and thereby create an even bigger hit on the economy.
So we'll see what happens. But you know, the numbers are coming way down. The ventilators, we're all set. We have a lot to go if we want, but I'm not getting calls where they need ventilators anymore. So we were right on those ventilators. I'd love to have additional ventilators for some of the countries that are our allies and our friends. And even if they're not our allies and our friends, you're saving human lives. But I'd love to see if we had some, I mean, we're making a lot of ventilators right now. We have and they take a while to make, and they're very expensive, and they're very complex to make. But I'd love to be able to help other countries once we're taken care of. But I just sent 100 ventilators to Colorado and that was great. A senator there who's a terrific senator, Cory Gardner, and he called me last night. He said, could you get 100 ventilators for Colorado? And we just sent them out, and they'll be there very shortly.
This is interesting and disturbing. The president does seem to be factoring politics into account when he is making these distributions. The Democratic governors of the hardest hit states, including New York and Michigan and Louisiana, are having a hard time getting equipment. But when Senator Cory Gardner, a key senator for control of the Senate, who is facing a tough re-election battle, gives him a call, reportedly then President Trump gives him exactly what he wants. President Trump has also given Florida's governor all of what Florida's governor requested. So Florida is, of course, a very key state to President Trump's re-election. So there are concerning political potential influences on who gets life-saving equipment and who does not.
We find ourselves in the midst of a very tough week for Americans in areas most impacted by the coronavirus, the New York City area, New Jersey, Louisiana. Continue to focus resources and attention on those areas, and I know that the hearts and prayers of the American people are with all of those communities. But in the wake of more than 1.9 million tests, we see more than 400,000 Americans have tested positive for the coronavirus, and sadly, we've lost more than 14,000. We grieve, but as the good book says, we do not grieve like those who have no hope. In this very special week, I know that the faith of millions of Americans is a comfort to them. The President and I spoke to more than 10,000 faith leaders, and we were able to express to them our gratitude for the way that they're strengthening the communities that they serve. But we also find hope in the numbers that Dr. Birx will continue to reflect on today. For as Dr. Fauci explained yesterday and in the days before, the losses, as grievous as they are, that we are seeing today are a reflection of people that contracted the coronavirus in many cases before strong mitigation steps were taken, before the guidelines for America fully took hold. The cases, however, and the new cases and the hospitalizations are in fact a reflection of the results of what the American people are doing. And I want to echo the President's and Dr. Birx's statements today about the extraordinary work the American people are doing, because we continue to see a great progress, low and steady numbers in the states of California and Washington. And in the New York metropolitan area, New Jersey, New Orleans metro area, Detroit, Chicago, and Boston, we continue to see evidence of stabilization that should be an encouragement to every American, an encouragement that we may be reaching the point where the impact of the coronavirus is beginning to level off. But it also should be an encouragement to every American to keep doing what we are all doing. Heed the guidance of your state and local authorities, and for every American, continue to put the White House coronavirus guidelines for America into effect. An area of particular concern we were briefed on this morning is the city of Philadelphia. I spoke today to Governor Tom Wolf, and as we begin to see early trend lines in Philadelphia, I assured him that we were going to continue to flow resources and support to that community, but our message to the people of the Philadelphia area is now more than ever practice the social distancing so that Philadelphia and to some extent even Pittsburgh do not have to endure what other communities before them have had to endure. Also today, at the President's direction, we hosted a conference call with every Republican member of the House of Representatives and every Democrat member of the House of Representatives.
This is just a petty thing that, notice that he doesn't say Democratic member, he says Democrat member. It's just kind of a petty little snub that Republicans do when they talk about Democrats.
We've made on paycheck protection. He reported to members of Congress that so far we're working with more than 3,600 lenders across the country, and we've dispersed more than $98 billion in forgivable loans. Now, these are loans that if small businesses accept this money and use it to keep people on their payroll over the next 2 months, they'll be completely forgiven. Treasury tonight will be issuing a new FAQ, frequently asked questions document, that will also make it clear that lenders may use their own closing documents for completing loan applications. And that information is available at treasury.gov and sba.gov as well. Dr. Birx, Dr. Fauci briefed the members of Congress today on the latest data. They'll both reflect on that in a moment. We also had Admiral John Polovchik talk about our control tower system and the extraordinary flow of supplies to critical areas across the country. We also briefed on the disbursement.
This administration continues to talk about the distribution of equipment as a success, as has been noted this week in a report by the Health and Human Services Inspector General. Hospitals across the country are experiencing severe shortages of basic equipment, including masks, personal protective equipment like gowns and gloves, and of course ventilators.
We spoke with the president of the Henry Ford Hospital, Bob Riney. It is the Henry Ford Hospital that is conducting a clinical trial for hydroxychloroquine. He expressed great enthusiasm for the work that they had done. They had a rather overwhelming response to the initial trial, which is beginning this week with 3,000 people taking the hydroxychloroquine or a placebo so they can match it. But
this push for hydroxychloroquine is so alarming because, as we mentioned earlier, there are very serious potential side effects to this drug. It has not been proven to work on the coronavirus, and there are now shortages for people who need this drug for the purposes that it was developed for and can't get it now. There should be research on it, but the president and vice president and talking heads for the administration on Fox News should not be publicly advocating for the use of it before it has been proven to have an effective use. And this is something that Dr. Tony Fauci has repeatedly stressed.
To the Navajo Nation and to Colorado today. But also today we received the good news that the first delivery of newly manufactured ventilators from General Electric and Hamilton arrived at the Strategic National.
Also, when he says that the placebo study is the next step, that is not the next step. The study has not actually been through a peer review. MDs and scientists have not been asked to weigh in on the previous study yet, so the next step that he's describing is not the next step.
4 flights scheduled to arrive today, primarily focused on gloves for our incredible healthcare workers. One flight alone had nearly 19 million gloves, another 8 million, another 15 million, and the like. And the American people, I think, would be very proud to see this vast array of now well more than 50 flights that are bringing in supplies from all over the world. And again, working through FEMA, we're directing those resources with the guidance of our scientific experts to the communities most in need. As we announced yesterday, the White House Coronavirus Task Force has requested that CDC and our team assemble data on the unique impact that we're seeing reported on African Americans from the coronavirus. Dr. Fauci spoke about it yesterday and will reflect on his perspective on that as well. Tomorrow, with the Surgeon General and others on the White House team, we'll be speaking with leaders in the African American community. And as Dr. Fauci will reflect, there have been historic challenges in the health care of the African American communities, particularly in our inner cities. And now more than ever, I'll just say from my heart to all of our African American family members, now more than ever, practice the guidelines. Look after those most vulnerable, people that have underlying serious health conditions. It's more important than ever that we all put those principles into practice. Finally, today, I'm going to have, after we hear from Dr. Fauci and Dr. Birx, I'm going to ask Dr. Redfield to step up, because today the CDC will be publishing new guidance on essential critical workers who have been exposed to COVID-19 but don't have any symptoms, don't have a temperature, and don't have any reason to believe that they have the coronavirus. At the present moment, the guidance is that if you have been in proximity to someone who did test positive for the coronavirus, that the guidance of CDC is that even with essential critical workers in industries from healthcare to food supply, that we ask people to stay home for 14 days. The new guidance tonight will hopefully make it clear that there would be an opportunity for those people playing such an incredible role in our nation's response to be able to return to work and to do so safely. And finally, let me just say again how inspired we are at the response of the American people to the coronavirus epidemic. Each and every day, as we see the beginnings of encouraging news, the low and steady numbers in California and Washington State, and now beginning to see numbers of hospitalizations going down and new cases leveling, and in some cases going down. We all hope it is the beginning of a trend, but we also hope it's an encouragement to every American to keep doing what you're doing, not just for your own health, for the health of your loved ones, but because we want to make sure that all of us are doing our part to make sure that the fewest number of Americans possible are exposed to the coronavirus. And given the fact that this, I remind you, is 3 times more contagious than the flu, each of us has a role to play in slowing the spread. That's what the 30 days to slow the spread is all about. It's about protecting your health. It's about making sure that our healthcare workers are and our health.
Each of us has a role to play, but because the president has refused to issue an actual national directive, there are 7 or 8 states with Republican governors that are not putting in place the very social distancing guidelines that the vice president is calling for. And we have seen in these states a big uptick in coronavirus cases in just the past few days.
To make that number of losses the lowest possible. And it will take all of us to do it and to keep doing exactly what we're doing through today. Dr. Birx.
Thank you, Mr. Vice President. I just want to start where the Vice President left off. I come out of the services, Army. We always talk about honoring the fallen, and I think for every American, what we can do now to honor the fallen that have fallen and given them really their deaths to this horrible disease, to the healthcare workers that are in the front lines trying to save every single one, to honor them and to honor our elders and the individuals that we know are at the greatest risk for bad outcomes. We all need to continue to do our work. Yes, the number of cases is stabilizing, but I do want to go through those numbers with you because we talk about these as micro epidemics in metro areas and in rural areas. So in the New York metro area, which includes obviously northern New Jersey, Connecticut, and Rhode Island, there are still 11,000 new cases per day, and their positivity rate on their testing is still in the 40% plus range. So there's still a significant amount of disease there, and everyone needs to continue to follow the guidelines. New Orleans metro area, 800 new cases per day, but a seropositivity rate on their testing of 28%. Detroit metro area, 1,400 cases per day, 26% positivity. Chicago, 1,200 cases per day, and 18%. Boston, 18% positivity, 1,100 cases per day. Denver has fallen to 180 cases per day, but still has 15% seropositivity in their testing. California and Washington have stayed stable at about Seattle, 350 cases per day. On the LA metro area, 800 cases per day, but their test positive rates are remaining in the 9% range. And so this really gives us some idea of what it takes. They have been continuously mitigating. Imagine what we're talking about, New York going from 40+% seropositivity and 11,000 cases a day down to the LA metro area of 800 cases per day and 9%. So this is what, when the president talks about reaching the top and coming down, those are the kinds of things we need to see. And the only way we will see them is if every American continues to follow the guidance. Now, in the Philadelphia metro area where I come from, it's 1,400 cases per day. This, of course, includes Camden, the counties around the Philadelphia metro, and Wilmington. And in the Baltimore and the Washington, D.C. area, 15% seropositivity and 500 cases per day and 200 cases per day in Baltimore. This is how we're looking at it, county by county, metro by metro, rural region by rural region, to make sure we don't miss anything. And we're triangulating testing data with the attack rates, with the hospitalization, with the number of cases, and really creating a mosaic of who needs what when to ensure that every American is served well. I had a great call today with a group of pediatricians, the head of the American Academy of Pediatrics, and with the American College of Obstetrics and Gynecology. Behind the scenes and working every day are the pediatricians fielding those phone calls from every concerned mother, and of course grandmothers like myself, and protecting our children every day to ensure that they have access to the medical care that they need while this is happening. And to every pregnant woman out there, I was very reassured hearing from the American College of Obstetrics and Gynecology. They have put amazing things in place to protect every pregnant woman. They have been social distancing in their offices. They have increased all of the disinfecting. They have lengthened the time between clients. To every pregnant woman, don't miss your appointments. If your OB thinks you need to be there, you should go. And please know that on the labor and delivery wards, they are doing everything to protect you and their babies. They are committed to you. They are absolutely committed to you having a good experience. Make sure if your physician believes you should be in the hospital for your delivery, make sure you're following their guidance. We don't want any pregnant women to suffer a bad outcome during this time. So again, I just want to conclude by thanking the American people and recognizing the number of people we're losing per day is serious to all of us, and it could be so much worse. But our frontline healthcare providers and the way they're talking to each other about how to improve care for every individual that they serve, you see them on the TV, you see them in the emergency room, you see what they're up against. This is how we can honor them, is to make sure we continue to put, as Dr. Fauci always says, put your foot on the gas and make sure that we continue to strongly mitigate and really protect those with pre-existing conditions. And finally, those pre-existing conditions we know now include asthma. So asthma, hypertension, cardiovascular disease, diabetes, any of these conditions, renal disease, no matter what age, please make sure you're following the guidelines to protect those individuals in your household. We know they're more susceptible to a worse outcome. We don't think that anyone's more susceptible to getting infected. I want to make sure that everyone understands everybody is susceptible to getting infected. This virus is very transmittable, as we well know. But we need to protect those that need our protection the most. So thank you all for what you're doing to get the message out to ensure that we continue to protect each other in this very difficult time.
Great. Dr. Fauci, please.
Thank you, Mr. Vice President. Just to follow up and underscore what Dr. Birx has said, as I've said many times from this podium, the spectrum of going from infection to getting ill, to requiring hospitalization, to intensive care, to death. And what is the most striking thing that obviously is so sobering to us is when we see the number of deaths. We know now for sure that the mitigation that we have been doing is having a positive effect, but you don't see it until weeks later. Remember this past weekend when all of us got up in front of this podium and mentioned that this was going to be a really bad week. At the same time, we were saying that we would hope we would start to see a little bit of a change in the daily hospitalizations, intensive care, and intubations. And New York is starting to see that. So I say that, but I drop back a bit. Don't get complacent about that, because what's going to happen 2.5 weeks from now is really what's going to happen with regard to the people who are getting new infection. As Dr. Birx said, everybody is almost certainly as susceptible as anybody else to getting infected. It's what happens to you after you get infected. And again, to just keep emphasizing, we need to keep mitigating. We know that this is something that is a strain on the American public, but it's just something that we have, not only the only tool, it's the best tool. And to just shift a bit to what we said yesterday regarding the African American community, it is very painful to see, and I've seen it throughout my entire medical career, that the health disparities in the minority community, but particularly the African American community, puts them at risk, apart from coronavirus issues, puts them at risk for diseases much more so than the general population. The double whammy that you suffer now is when you have this terrible virus, which essentially preys in its ultimate deleterious effects on people with those underlying conditions. And since that is more predominant in the African American population, we want to double down and say to the young people, to the elderly people in that community, to please try as best as you can to protect yourself if you're a younger person, and to please protect the people who are susceptible. Your grandmother, your grandfather, your elder uncle, the people who have these underlying conditions. Because we are not going to solve the issues of health disparities this month or next month. This is something we should commit ourselves for years to do. But what we can do now, today, is to prevent people who are put at higher risk because of their demographic group from getting into a situation which is much, much more deleterious than the general population. So I plead with all of us in the population, but particularly for those of us, our brothers and sisters in the African American community, because we know that mitigation does work. The reason we know it works is the question that was asked about the numbers, that why they came down with the projections. Because remember, what you do with data will always outstrip a model. You redo your models depending upon your data. And our data is telling us that mitigation is working. So again, as Dr. Birx said, keep your foot on the accelerator, because that's what's going to get us through this.
Dr. Redfield.
Thank you, Mr. Vice President.
So this is Dr. Redfield, the director of the CDC, and a reminder, as I mentioned earlier, he was a key figure in the Reagan administration's somewhat disastrous policies regarding HIV and AIDS, and he was part of a group that called AIDS God's Judgment, and he discouraged the use of condoms or the creation of needle-sharing programs.
Essential workforce, and how to maintain that workforce, particularly at this time as we begin to get ready to reopen and have confidence in bringing our workforces back to work. And so we've put out a new guidance for essential healthcare workers who've been exposed to the coronavirus. These are individuals that have been within 6 feet of a confirmed case or a suspected case, and so that they can, under certain circumstances, they can go back to work. If they're asymptomatic, as the Vice President said, they could go back to work if they do several things, as we say here. Take their temperature before they go to work, wear a face mask at all times, and practice social distancing when they're at work. What we'd ask them not to do where they're at work is we want them to stay at home if they're sick. We want them not to share objects that would be touching their face, and we would like them not to congregate in break rooms, lunch rooms, and crowded places. And in the second slide, if we're talking to the employers of these critical industries, we would ask those employers to take the employee's temperature and assess their symptoms before starting them back to work. If the employee does become sick, we want them to be sent home immediately. We'd like them to increase air exchange in the buildings and increase the frequency of how they clean common surfaces, and really begin to get these workers back into the critical workforce so that we won't have worker shortage in these critical industries. So that's the new guidelines that CDC will be posting today.
So the CDC is now essentially loosening to try to get more people back to work. From Professor Howard Koh of the Harvard School of Public Health, it is way too early to even consider rolling back any guidelines. With cases and deaths rising by the day, the country must double down and not lighten up on social distancing and related measures.
As the supply, and with regard to what we're gathering from literally around the world, and from manufacturers in the United States, is first being deployed to states and to hospital systems. But I must tell you that whether it be the Haynes Company or other companies, we're seeing manufacturers in America that are recognizing
The Vice President is celebrating manufacturers who are voluntarily stepping in to make equipment at this time. We cannot stress enough that the President has the power to call upon them to do so and coordinate plans for them to do so by using the Defense Production Act. Governor Cuomo of New York has said that there is no reason why every apparel company in the country should not be creating masks and protective gowns right now.
Has included ventilators, and does she need to be calling the White House instead? Have you spoken with her directly?
I've not spoken to the governor directly, but I'll reach out this evening, certainly. In our conference call with governors this week, we spoke to them about the approach that we are taking. You know, traditionally, governors are accustomed to when a hurricane strikes the Gulf Coast, when wildfires strike out west, when flooding or tornadoes hit in places like Indiana, you're accustomed to have a declaration of emergency approved, and then resources flow from FEMA. In this situation, as we deal with a nationwide declaration and an epidemic, what we've explained to governors is that what President Trump has directed is that we leave no stone unturned to find resources around the country and around the world, including ventilators.
This is just not true that they are leaving no stone unturned, because as we have been highlighting, the President has not fully enacted the Defense Production Act, which would enable him to turn over more stones for this equipment.
That we're looking at their numbers every day, just as in the case of every state in the country, and we're going to work our hearts out to make sure that as the coronavirus cases emerge, and we hope that through the great work that Kansas has done on social distancing and mitigation, the people of Kansas have done a remarkable job. That we may well be to a place where their existing resources and capacities are present, but we want people to know that taking the counsel of Dr. Birx and our entire healthcare team, we're focusing, just as we did first in Seattle, California.
He's highlighting the work that Kansas has done. Kansas was, I'm sorry, I'm going to pull up the numbers on Kansas. Kansas was a little bit late in implementing restrictive guidelines.
There's actually a controversy right now over her order to limit the number of people in religious gatherings to 10 people. Should states be telling religious institutions how many people can gather if it's to stop the spread of the coronavirus?
Well, the President's coronavirus guidelines for America ask every American to avoid any gathering of more than 10 people. And that's on the advice of all of our best scientific experts as a way that we can slow the spread. But as we've made clear to every governor, we defer to our governors in what they believe is the best and appropriate practice in their states, and we'll support those local decisions. Yes, please.
Thank you. In his opening statement, the President said there were 10 drugs that are now in clinical trials. Would hydroxychloroquine be one of those?
Well, I can speak to that, and then I'll invite Dr. Birx, Dr. Fauci to come forward. We do have, I believe, we will have roughly 4 separate clinical trials underway studying hydroxychloroquine. But it's important to remember that that, as the President's made the point many times, the FDA has approved what's called off-label use. And so in consulting with your physician, if your physician determines it's appropriate to write a prescription for hydrochloroquine, we're working today to make that available across the country. It's broadly available today as an anti-malaria medication, but we're working around the country and internationally to increase that supply. But we are studying it in at least 4 different clinical trials, and Dr. Fauci can speak to that.
So the easiest, thank you for that question. The easiest way to find out is to just go clinicaltrials.gov, and it will tell you everything that's there. There are a number of different clinical trials, some of which are randomized controlled trials, which, as I've said many times from this podium, to me is the optimal way to determine ultimately if something is safe and effective and works. But there are a lot of different ways that that's being looked at. It's being looked at against the placebo. It's being part of a multi-arm trial, comparing it with others. There's a trial that was recently started actually in prophylaxis among healthcare workers. So there are several of these. In addition to that, there's what was just mentioned now, that any physician in consultation with their patient and back and forth can make the decision to use the drug on an off-label. So we have 2 things that are simultaneously going on. We're having actual formal clinical trials and the off-label use.
Very good. Next, please.
I want to turn back to the disproportionate rates of Black deaths when it comes to the coronavirus. Dr. Fauci, you have been talking about this for weeks, that there are underlying health issues. People with underlying health issues are most at risk. But if we knew that Blacks disproportionately have fallen into that category, why wasn't the CDC prepared to gather this data in real time to work to fight this?
Well, I'm not sure. Well, we have the director of the CDC here who could answer that question, but let me try to just take it from a different perspective. The health disparities that exist are not anything that started with coronavirus. They were there. So there isn't much you can do about the disparity. The thing you can do is to make an extra special effort to protect people who have the underlying conditions. So it's the same way as we say, well, the elderly and those with underlying condition. Unfortunately, the African American community has a much greater proportion, population for population, of these underlying conditions. So the best weapon we have right now is what I said in my opening remarks, is to do whatever we can to get them to realize that what we need to do is to protect them from getting infected and to also protect them from inadvertently and innocently bringing the infection to people who have these underlying conditions.
Thank you, sir. Can you explain the thinking behind these 100 ventilators that were given to Colorado when other states like Kansas have had trouble getting ventilators? And can you say whether a personal relationship with the President is helping states like Colorado get these ventilators? I mean, there are 15 states that have more cases than Colorado.
Well, what I can say is that we've been watching Denver very closely, and like many of the other key areas that I touched on.
I want to point out that the Democratic governor of Colorado, Jared Polis, begged Pence and Trump for ventilators in a letter sent more than a week ago. And it is now, supposedly after a phone call from Senator Cory Gardner, a senator who is locked in a very difficult re-election battle that could determine which party controls the Senate, that President Trump made a very public announcement that he was personally providing these 100 ventilators at the senator's request. So it is very fishy that he is responding to this embattled Republican senator while he is disregarding the calls from the Democratic governor of that state.
In those communities to know for certain that we're going to move resources into those areas where we see significant outbreak.
Can you just address the point about whether individual government relationships with the president are getting preferential treatment?
I can tell you within that decision complex is not just the absolute number of cases, it's the hospital capacity and what each of those hospitals have. So remember, I think a couple of days ago we talked about how the states are sending the information about ICU beds, hospital beds, ventilator needs. So different states have different, which I don't think any of us probably knew before this, but there are some states that have lots of ventilators, and there's other states that proportion to their population or by their cases of COVID have less. And so I'm sure Denver and Colorado fit into that model where there were hospitals that had less ventilators proportionally and were needed for the cases that were seen. So that's the kind of analysis. So every state that has a few cases more than Colorado have all received ventilators except for, I think, Texas, and that's just because they are just starting.
Well, Dr. Birx is providing some cover here, but the fact remains that when the request came from the Democratic governor, it was ignored, and when the request came from the embattled Republican senator that President Trump is relying upon if he hopes to, if reelected, still control the Senate, President Trump responds differently in that case.
A follow-up on the church's question. You're obviously a very religious man. Will you be going to church on Sunday?
We'll be attending church right in the living room at the Vice President's residence, where we've been attending for the last several weeks. The advantage is we get to go to our home church in Indiana.
Is that the same example you'd like to see churches around the country, regardless of what governors are saying, do as well?
Well, I think the President's coronavirus guidelines for America are very clear.
The President's coronavirus guidelines are not very clear. Multiple Republican governors are not putting them into place because the President has not explicitly issued them as a directive. And the governor of Florida, although he has belatedly finally issued a stay-at-home order, he has waived it for places of worship. And he has barred local authorities from putting such a ban in place in their area, so that people are being urged to gather together in places of worship, potentially hundreds of parishioners at a time, and then go back out to the community and potentially spread the coronavirus further.
To heed the counsel of the guidelines, put those into effect, and know that in so doing, we'll hasten the day. We'll hasten the day that we put the coronavirus in the past and we reopen our country.
Mr. Vice President, last question. Last question of Dr. Birx or Dr. Fauci.
Of course.
As you are both probably aware, there's a lot of misinformation, conspiracy theories out there about the coronavirus. There are some commentators who are suggesting that the number of dead are being inflated because they're saying that people who are dying with other issues are being listed as COVID-19 deaths. Perhaps you've seen some of this commentary. You may be too busy to see it, but it is out there. What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded? For example, somebody who might die from a number of factors.
There is evidence that the reverse is true. WNYC has confirmed that there has been a 400% increase in at-home deaths in New York that have not been classified as coronavirus deaths. And that may well be because it is so hard to get testing here. It is much more likely that there are many coronavirus deaths that are not being diagnosed as such because the patient did not test positively, it did not have a test, and died at home rather than in a hospital.
So those individuals will have an underlying condition, but that underlying condition did not cause their acute death when it's related to a COVID infection. In fact, it's the opposite. Having that underlying condition and getting this virus, we know, is particularly damaging to those individuals. We don't know all the pathophysiology. I wish we did right now. We see a lot of vasculitis, where Tony and I came from. Tony actually, Dr. Fauci started in the vasculitides and Wagner's. So, I mean, these are things we have studied for a long time. We are trying to understand the pathophysiology, but what we can tell you at this moment, if you have asthma, if you have renal disease, if you have diabetes, if you have hypertension, these are pre-existing conditions that put you at a greater risk to having a worse outcome.
So, Jim, just to add a comment to that, because, having been through other serious issues, particularly the very painful early years of HIV, AIDS, when people talk about conspiracy theories, you will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. I can assure you, we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.
Dr. Brooks, you said something about not enough tests being performed because some of the labs, the machines aren't running. Did you want to clarify that? What did you mean by 80% weren't running?
So I have a call with them at 8 p.m. tonight. Every single one of those 120 laboratories, I think 87 of the laboratory directors have confirmed that call. It has to do with a machine called an Abbott M2000. It's a very high throughput machine. We have 1 million tests out there. I made a big push, and Abbott was extraordinary about getting those out to the labs. I mean, this is not sitting in a warehouse. These are physically in these laboratories, sitting there right now.
The machines aren't running.
They're not running. So we've only run 88,000 tests in 3 weeks off of those machines with 1 million test kits. So as someone who has worked in a lot of laboratories, to have a machine that is needed, because we could have screened every healthcare worker. These machines are every place in the country. So they could have screened in these last 3 weeks 100% of the healthcare workers across the country that needed these tests to be done, and they're high throughput. So I have a call with them at 8 o'clock to really talk about.
Can that to happen? Can an order be given?
Well, I asked the vice president to give me a chance to talk to my colleagues first, but we have a call with the CEOs of those hospitals tomorrow.
Great. Thank you. That's a really important question, and it underscores the.
I do want to point out when Dr. Fauci specifically talked about comparing the conspiracy theories here to the conspiracy theories that were spread during the early stages of the AIDS crisis. You've got two of the people who spread them right there on the stage with both Dr. Redfield, now the director of the CDC, and Vice President Mike Pence, now the director of this task force.
Laboratories machines, and know that that's, while we've already tested more than 1.9 million Americans, our short-term objective is to test as many Americans as possible as we see the coronavirus epidemic emerge in areas around the country. We want to surge those resources.
And the Vice President is talking about a strategic approach to testing. The failure to implement a strategic testing plan is probably the most pronounced failure of this administration's response. And as I mentioned earlier, a new Washington Post report reveals that there is still not a national testing strategy in place. and states are still being left on their own to figure out their own statewide testing strategy, which is why in New York, where there's still a shortage of tests, New York is performing, or has been performing, roughly 25% of all the tests being done in the country.
And trust sooner rather than later that when next fall comes, that we will have a vast array so that CDC can do what it does so well. And that is when a particular disease emerges, CDC surges personnel, does contact tracing, isolates that individual. So we're just really calling on all of our partners in the laboratories and in hospitals around the country to identify those Abbott laboratory machines and help us continue to scale up and expand testing. But to every American, let me again just say thank you. Thank you for what you're doing. We are in the midst of a week of heartache, and I want to assure every American who has suffered loss that we're with you. We're praying for you and your families, and we'll continue to work our hearts out to make sure these incredible healthcare workers who are inspiring every single one of us all across the country every day have the resources and the support and the equipment to do their job safely.
We know that our healthcare workers do not have the resources they need to do their jobs safely. And as we have reported, here in New York, there was at least one hospital where nurses were wearing garbage bags in lieu of protective gowns because they could not get them. And the Inspector General of the Department of Health and Human Services released a report just this week revealing a widespread pattern of lack of resources at hospitals in at least 46 of the 50 states.
Extraordinary progress in California and Washington is a tribute to the people of those states and the leadership of those states. But the beginning of stabilization and perhaps even leveling in New York and New Jersey, Louisiana, and Detroit is a testament to the people of those communities, to the leadership of those states. But understand that every one of us has a role to play to protect the most vulnerable among us and to save lives by putting the guidelines into practice, just like you've been doing every day since they were first announced. So thank you all, and we'll see you tomorrow.
And that is the end of today's Daily Coronavirus Task Force briefing. Thank you for tuning in. If you are celebrating a Passover Seder this evening, I hope that however you are celebrating it, that you are able to share in the spirit of hope and life in the face of death, hope in the face of despair. That is the guiding spirit of that holiday. That is the guiding spirit of the upcoming holiday of Easter. And together we will all get through this. That white object in the background is, again, Mew the fluffy cat. Did not expect her to make an appearance in the midst of a solemn statement that I was trying to make. But I thank you for tuning in. I had the support today of many members from our newsroom producers, including Maddie Green, Megan Hirschlein, Matt McDonough, Ian McKenna, Nico Pitney, and Shelby Vaculin. We will be back tomorrow to fact-check the president again. Please stay safe. Please stay close to the people you love, in spirit, if not in body, and please let them know how much they matter to you. I'm Alan Piper. Have a good night.